Hi, this is Neil Versel at the Mobile Health Expo in New York City. I'm with Wendy Thomas, who is the founder, creator, and leader of the Mobile Health Expo. And Wendy has some exciting news that she dropped here this week, and that's that the Mobile Health Expo is going to be forming the Mobile Health Association. Is that correct?
That's right, yes.
Tell me what the philosophy behind that is.
Sure. The idea is that there is a need for an association that is an umbrella organization over all of the special interest groups and associations that actually make up the mobile health ecosystem.
Such as wireless, telemedicine,
Connected devices,
health, yeah.
exactly,
Mm-hmm.
yes. So what we found is that, and mobile money even too, there are many different special interest groups and even other associations that have some similarities but are also very specific to their own special interest area. I use the analogy, it's like the Photographers Association,
mm-hmm.
and within that association there are wedding photographers
mm-hmm.
and sports photographers and press photographers, and so although they have a special field within
mm-hmm.
that photography ecosystem, they are very specific, and so there's some overlap and some shared interests
mm-hmm.
and some specific interests, and that's what we're doing, putting the umbrella organization over all the others.
Right now the idea, it's pretty nascent at this point. You're trying to see, you haven't really decided what direction you're going to go, you're just sort of doing some outreach to
we put a call
out
a call for interest here at the Mobile Health Expo, and we've already received enough interest that we know that it's worthwhile to move forward with. And so our announcement was that we want to see the interest for individuals and corporations and associations that are interested in becoming a part of the Mobile Health Association, and it was very well received, and so we will be moving forward with it, and our next step is to collect some of the thoughts and input that we got from the founding members, and to look at hiring an executive director. And
so you've done all the background work, all the incorporation and all that, or is that kind of the next step?
The market research work on that has been done, and the discussion with the lawyers, and so that's in place, and that
okay.
right. So hasn't been formed yet. We wanted to make the announcement and see the interest before we did it, but
okay.
it's
you believe already in just one day that it's...
Oh, definitely, yes. The reception was wonderful.
Okay, so what do you have any kind of direction as to where you're going to go, or any thoughts as to how you do want to proceed, or how you want the structure to look like, say, a year from now, 2 years from now?
Well, we have a couple of options,
mm-hmm.
and I know that it will be a not-for-profit for mm-hmm. sure. And the question is whether the idea is that it will be made to educate mm-hmm. and then also to pool resources in order to influence policy. Mm-hmm. And so that in that term, other than those two things and initial mm-hmm. goals, that's the basis of the association.
And I will qualify that by saying there were some veteran lobbyists who spoke on a panel here at this conference, and also at the first Mobile Health Expo last year in Las Vegas. You had many of the same people. So
that's right.
Yeah, so you've got some people who know how to influence public policy.
That's right.
That I know will be working with.
Right, that's right. And we actually consulted with several of them about the formation and which direction do we need to go to use it mm-hmm. to make sure that we form the proper not-for-profit that actually mm-hmm. can do those types of things. So.
And this will be a national organization or an international organization?
International organization.
It will, okay.
Yes, and initially within the U.S., but then we'll probably mm-hmm. expand it into other countries based in 2012 as
mm-hmm.
we expand the Expo into those other countries as well.
And you do have plans to go overseas, and there were a few
yes.
international people here from really as far away as New Zealand, I understand.
Yes, yeah, there's quite a trip.
Yeah. So, when can we expect to know more?
We'll issue a press release tomorrow mm-hmm. on just the announcement, and then look for the next few weeks for us mm-hmm. to start to go out and approach membership and create the brand around it, and mm-hmm. And a little more information from some of the founding members and those people that we are electing to put on the board.
Okay, so you have an idea as to what the makeup of the initial board is going to be and who the founding members are. Any names you'd like to
Not yet.
Right
I think
okay.
it's going to be very organic because it's such a broad, it's so broad
Yes.
that we really receive so much interest. We don't want to have the board overweighted too much in one direction. We really want to keep it very even and then rotate those positions within.
And it really is. I mean, let's face it. It's kind of an immature industry, and that's not a negative connotation. It's just an industry that is so new and sort of coming up from the grassroots more than top down, that a lot of things are in flux, not just within your association, within the conference, but really in this whole industry. And what we call mobile health hasn't even really been well defined.
That's right. Most of the companies that are coming into this space, we work very closely with a lot of entrepreneurial companies. That's what we see at our expo. It's mostly entrepreneurs that are out there and trying to build a new service or a new model. Even the big companies that are doing things, they're taking an entrepreneurial approach where it's a line of business. And so what they're doing right now is they're hiring the people, just like we would be doing with the association, that have the skill set to go in and put this new model and new services in place. And so I think it's in the infancy, and you have to hire the right people that can build it first.
Okay. All right. Well, thank you, Wendy, for your time, and good luck with your endeavors.
Thank you. I appreciate it.